Columbine, Aurora, Newtown, the Washington Navy Yard. These national tragedies and others like them have left our country in a state of shock, grief, and anger. We're also left asking a lot of questions. How could this have happened? And could it have been prevented? As our leaders look for answers to these national crises, the public dialogue has shifted focus to mental health. According to the National Alliance on Mental Illness, 1 in 4 adults experience a mental health disorder each year. All age groups are affected by mental health needs, from infants to seniors. The symptoms of mental illness can be difficult to detect, and even close family and friends might not know how to intervene or direct their loved one to treatment.
Most of the people that come to us are in crisis, and they're hunting for answers or hopes or even other people who maybe have similar experiences.
A lot of our clients, house residents, are what known as have the co-occurring disorder, so they have the substance abuse problem with the mental health, and it's very common. It's not necessarily disorders like schizophrenia or bipolar disorder. It could also be anxiety or depression.
Youth are more susceptible to mental health problems due to minimization from bullying and the extra pressure from social media.
I think technology's changed the way that youth process their own social and emotional health needs, and oftentimes they do that through social networks, and these can sometimes be real cries for help.
People who are homeless and seniors are at a greater risk of being untreated for a mental illness due to lack of resources and consistent care.
Everybody has some mental health issues, and most people that we meet on the street have some pretty serious ones and some pretty serious trauma.
So you have the suicidal thoughts, you have the anxiety, the PTSD, the depression, and it's really prevalent out here, especially when you have drinking and drugs.
Being able to detect when a person is developing a mental health disorder or having a mental health crisis is critical to de-escalate situations in which a person might be harmful to themselves or others.
We're going to do some sandwiches, and we try to build the relationships with them, and so that they can trust us enough to start talking and opening up. And that's when we can kind of figure out where they're at emotionally, where they're at mentally, and try to work with them to get them off the street.
Mental Health First Aid is an 8-hour training program that helps participants identify risk factors and warning signs of common mental illnesses. They learn how to develop a 5-step action plan to help an individual in crisis connect with appropriate care.
Mental Health First Aid is a first responding model similar to first aid through the American Red Cross, CPR. This one is really addressing individuals that have a major mental health crisis or a major substance abuse crisis in the community.
Ideal candidates for mental health first aid training include anyone who has regular contact with the public, such as law enforcement, health and human service personnel, teachers, volunteers, coaches, and cashiers.
Mental health first aid gives us that tool that if someone is in a mental health crisis, we're comfortable. We know what the guidelines are for when to get help. We know not to be afraid of that condition. We've practiced and learned to be comfortable with it.
Helping people recognize that this is a disease and illness. Doesn't define the person, it's not what they're defined by, and that they can get better, they can get help.
AspenPointe has been offering mental health first aid training since 2009. While there is significant cost associated with this program, AspenPointe provides the training free to the public. This is a way we can all make our communities a better place to live. Please consider donating to AspenPointe's mental health first aid training. A mere $20 will pay for someone's textbook. $50 covers the full course. You can pay for an entire class to be trained for $2,000 or sponsor the certification of an instructor for $1,000. Every bit helps. Thank you.